RSV is hitting kids hard this year in a way doctors say they have never seen before. Good evening. Thanks so much for joining us. I'm Marcella Lee. RSV is a common respiratory virus, but health experts say it's hitting kids earlier in the season than they're used to seeing, which is really putting a strain on hospitals. CBS 8's Shannon Handy spoke with the head of infectious diseases at Rady Children's Hospital today and shares what parents need to know. Shannon?
In just the past 2 weeks, 400 kids have tested positive for RSV here at Rady's. Between that and all the other viruses going around, it's led to long lines in the ER. One-year-old Dominic is one of several kids who visited Rady Children's Hospital Tuesday. His mom brought him in for what she suspects might be respiratory syncytial virus or RSV.
Hard because there's not much I can do, and he's one, so it's like he's not telling me what's actually hurting or anything.
Dominic has trouble sleeping, a decreased appetite, and a cough, all of which are symptoms. Others include a runny nose and fever. Oftentimes, RSV looks like the common cold and in most cases will go away on its own. But in younger kids, especially those under 2, it can lead to something more serious.
What RSV does, especially in younger children, is it causes inflammation in the lung.
Dr. John Bradley is the director of infectious diseases at Rady Children's Hospital, where right now 40 kids are being admitted every week with RSV. A telling sign your kid has it is if their breathing appears fast or labored.
Where they're going, then you know that the body's trying to get more pressure and more oxygen into the lung.
According to the CDC, RSV leads to nearly 60,000 hospitalizations among kids under the age of 5 annually and between 1 and 300 deaths nationwide. Normally, doctors see RSV in December or January, but like the flu and other viruses, it's spreading rapidly much earlier than expected.
Now the kids aren't wearing masks and kids are all back seeing each other in school and playing and parties and sports. The viruses are taking advantage of that.
That's led to a surge of families seeking care, straining hospital resources. Dr. Brownlee says while Rady's hasn't had to turn anyone away, some families are having to wait up to 6 hours to be seen. Regarding RSV, he suggests first checking with your primary care doctor, especially if your child only has mild symptoms. But if you notice the labored breathing he talked about, go to the ER. Other things to note, RSV can be detected with a simple nasal swab. There's no treatment for it unless it leads to other things like pneumonia. Older kids and adults can catch it too, but the symptoms aren't as extreme unless they have underlying conditions or are over the age of 65. Dr. Bradley says there could one day be not only medicine to treat RSV, but also a vaccine, both of which are in the works. Shannon Handy, CBS 8.